Hello, everybody, and thank you for joining us and for watching the recording. We have our presenter here, Ms. Kendra Mitchell. It is so good to see you, my friend. And I did not actually see any questions in the recording. I do apologize. I know there was a little bit of confusion for folks that were joining here, joining there. So I appreciate everybody's flexibility. But I do want to open it up for any questions or discussion. We'll continue letting people in as they come over from watching the broadcast. And thank you, Kendra, for that incredible presentation. So I will turn it over to you and open it up for folks to either put their questions in the chat or unmute yourself, turn on your video, and let's have some FaceTime.
Awesome. It's so good to see you too, Mallory. Look at you. You look gorgeous. Thank you guys for being here. And I hope that it was an informative session. Just to start out, are there any questions? And then I've got a couple of questions for you guys. So are there any questions or anything that needs clarification? No, not yet. Okay, well, I have a couple of questions for you guys just to kind of start the conversation and the discussion. So what are your roles with youth and family engagement? And feel free, please take yourself off mute and let's just have a little chat. Anybody? No?
I do see a great question in the chat that I think we all know comes up quite frequently. Could you talk a little bit about how do you fund a youth advisory council?
Jackie, you've had a little more experience with the funding portion. Do you want to touch on that part?
Sorry, can you repeat the question? I was having a little delay here.
Sure. Marcia asked, how do you fund the Youth Advisory Council? And I know this is a topic that comes up quite a bit that I've heard. So if you could speak to that.
Good. Hello, everyone. I'm Jacqueline Johnson. I am the Title V Children's and Special Healthcare Needs Director for Tennessee. And we're fortunate in Tennessee that we have a contractual agreement with Family Voices. And so funds are put in that contract to provide for initiatives, activities, things of that nature, even some reimbursement for families and for our youth. And so being able to put it in a contract makes it a little bit easier. And then, of course, if there are areas that are not covered in the contract, we're also able to just direct bill for those services through our maternal child health block grant.
Thank you. There's another question from Morgan Williams of Pennsylvania. How are youth recruited to be on the Youth Advisory Council, and are they compensated in any way?
Yeah, that is a great question. So recruitment takes place through just a series of different things for us. So we've got flyers, we've got word of mouth, things like that. But once the youth express interest, one, they have to be 14 to 24 to be a part of the Youth Advisory Council. And they go through an application process. They just tell us a little bit of information about themselves. And then we just do a little onboarding with them, answer any questions or concerns they may have. When we were in person, we did pay for mileage. And then we also would provide the youth with dinner or lunch, whatever time of day it was. And we also would give them like a $20, $25 gift card for them to use on whatever they wanted.
And I just want to add to that. When we initially started our Youth Advisory Committee, we actually created a collaborative effort between Family Voices and our LEND program in Tennessee. And so the first real big push for recruitment actually came through the LEND program. And so we were able to pull in a lot of families through. There were a couple of individuals that were in the LEND program that had access to youth through other positions.
Jacqueline, I'm sorry, I don't know if it's this way for anyone else. Your audio is a little cutting in and out. I don't know if you can maybe get closer to your microphone, or you just sound a little underwater. Yeah.
Thank you. I've had that problem all week. I don't know what's going on. But anyway, so initially when we started with the Youth Advisory Committee, we did a collaborative with Family Voices and with the LEND program. And so there were individuals who were in the LEND program that actually through other activities or initiatives that they were involved in had access to a wide range of youth, and some with special healthcare needs, some without. And we had a big kickoff meeting and invited all those youth, provided a meal, as Kendra said. And even I think we did maybe some kind of gift card or something that covered gas. And so that was the initial push for recruitment. And then at this point, it's word of mouth. It's, wherever we can put the information out there. And then, of course, other youth have invited youth to come and be a part of the Youth Advisory Committee. And of course, Kendra, don't forget about the other agencies that we work with in the state, but also we have a collaborative work group with other agencies who provide services for youth with special needs or without. And we're able to recruit from that perspective as well.
Great. This is a question from Emily Yeats in the broadcast window, and this is a really great question. How does Tennessee prep other members of the Title V team to be ready to receive feedback youth may provide? We found that sometimes state policy stakeholders think they want youth input, but they're not quite ready for it. Thoughts?
I can touch a little bit on it, and Jackie, please feel free to jump in. One thing here in Tennessee, they are very open-minded about the youth voice. They want to hear what our youth have to say, and we've actually had meetings with the youth regarding our Title V process, our planning process, and all of that. So they were very engaged with that. And our department and other departments, they were very receptive of what our youth have to say. They do have strong voices, and they do not have a filter, but they do let us know what it is that they want. And we try our best as a state agency to work with our partners and make sure that their youth voice is heard and that they're actually getting the things that they've told us about. Jackie, do you have anything to add?
Just to add on, I think the question was, how do we prepare Title V members for interaction and information from the youth? So we've been fortunate in Tennessee that for several years, we have had a major push in our Title V section, which we call Family Health and Wellness. It was initially Maternal Child Health, but it's Family Health and Wellness now. And we have had a major push for many years now to be inclusive of families and youth. And we actually did some work early on with Family Voices to try and build those relationships. And when we talk about family and youth engagement, it's not just for children, youth, and special healthcare needs. We have been very intentional with ensuring that we provide family and youth engagement and involvement across the board. So many of our programs, WIC, chronic disease, safe sleep, injury prevention, several of our programs in the maternal child health section there, family health and wellness section, have also utilized our families and youth to help with policy creation and reviewing policy and giving feedback on brochures and public, presentations or media presentations. And so we've been very intentional with that. And that has created an opportunity, or has lessened the anxiety, I guess, for members on the Title V side to interact and to receive information and guidance from our youth.
Thank you. Another question, I'm kind of bouncing back and forth here between the Zoom and the recording window. One great question. We are in the process of creating a youth advisory board here in Indiana. We have youth ages between 13 and 23 and have a lot of people ask if we will keep them all together. Do you have any issues in having youth under and over 18 together in this work?
Actually, we have not had a major issue at all. Our older youth and young adults, they become mentors for the younger ones. And it's actually so amazing to watch them. You would think that there would be issues with the age range just because some of them are they're going through different periods of transition in their lives, but we have not had any major issues whatsoever. A lot of the things that the younger youth deal with, the older youth have already dealt with it, and they kind of just they give advice, they help each other out. They have their Discord, they have their group me, and all of them are in there. So if there's any given time that even one of our older youth or young adults are going through something, anything. So for example, one of the most recent cases was a situation with IEP, schools ending, things like that. It was amazing to see a younger youth give one of the older youth advice about an IEP just based off of a training that she did. So they're there to help each other, and no, we have not had any major issues with the age range.
Thank you. So there's a couple in the chat that I'm going to combine. One comment says, I love to hear that family and youth engagement is across the board. How do you all recruit and retain these partners, especially youth and young adults? We've had a couple questions about recruitment. So if you could just elaborate on that. And then one other question, how long have you had your youth advisory council?
I'm going to leave the how long we've had it to Jackie because she was the one who was here when it started. So I'll leave that question to her. As far as recruitment, so it's actually amazing the way recruitment works with us. So I have the honor of actually overseeing a youth engagement work group. And this is a work group where I get to collaborate with different state and community partners, and we're all serving the exact same population. Many of us are serving youth and young adults with and without disabilities. So through that work group, we are able to recruit that way. And then honestly, the youth recruit themselves. So it's kind of a win-win situation where we're all able to come together as adults and recruit, and then our youth are able to come together and they will do whatever they need to do on their end, whether it's going back to schools or getting all their friends on social media. They're huge on social media. That is their thing, that is their platform. And so that's typically how we recruit from both areas. And then Jackie, I'm going to turn it over to you for the length of time.
I want to say that we started our youth advisory in 2014, and I was just sitting here trying to remember. Of course, Kara was unable to join us today because her son, Kale, who started out with us, is graduating, as she mentioned on the presentation, and they have some graduation kind of things going on today that she had to take care of. But just for those of you who are familiar, know who Dr. Warren is. Dr. Warren was our maternal child health director at one point, and we had gone to Atlanta for a block grant review. And on the way back, that's when we started taking our family voices representatives with us for our review. And in the car, it was myself and the director of family voices at that time, Belinda, Dr. Warren, and maybe one other of our Title V members. And we were just kind of brainstorming and talking about, we'd always talked about having a youth advisory and having a family advisory committee. And we just kind of brainstormed and just kind of walked through that. And when we got back from Atlanta, we set out to develop this youth advisory, and we used our family delegate at that time to help us to pull everything together. So I'm pretty sure it was 2014. If not, it would have been 2013. But very early on, we've been So we've been in it for a while now.
Thank you. So we have a couple other questions. I know you touched on this earlier, but more people have joined and it has come up again. Could you just mention quickly about your sort of compensation or how you incentivize youth for their participation? And then somebody else also asked about the orientation for when youth come on board and key areas you see that youth would benefit from as far as skills to help them giving feedback to Title V staff. I know that's a lot all at once.
That is a lot. I think I have it though. So if I miss anything, please just ask me again. So just to piggyback on compensation. So when we were in person, right now we're doing a lot of things virtually because our youth are just not comfortable yet doing things back in person. A couple of weeks ago, they did say that they'll do some outdoor things, but in the past we would give them lunch or dinner, and then we would do gift cards for them. So we would kind of just open it up and let them decide what they wanted their gift cards to be. A lot of them loved Target, so for several months it was just Target gift cards, and then it went to Walmart gift cards, and then it went to Visa gift cards because they're like, okay, we want to do online things. So that's what they got. And then of course we paid for their travel and different things like that. As far as the orientation, we do not have a set standard of orientation. What we've found, youth they're all so different. So you may have a sheet of paper in front of you where you're going down a specific list of things that you want to share with them, but they're not going to receive the information the same way. So what we have been doing is with our new members, we will meet with them individually, and it's typically through a Zoom link or something like that. And we open up the floor for them. We go through their application. We ask them questions. We allow them to ask us questions. And it's just so much better that way versus putting them all in a room together or on a link together. They're not going to typically talk to you that way. They're new to each other. They don't know each other yet. So we do take the time to meet with them individually with that area. What were the other questions, Valerie?
Thinking about the key areas and skills that would help them and lessons for Title V staff.
Yeah, so some of the key area, I'm going to say the key area for our youth is advocacy. They're very strong to, they always want to learn more about self-advocacy and about transition, all the domains of transition. The skills that they typically want to learn and have learned really is geared around self-advocacy, and they take that, and that's how they're able to successfully transition and navigate through different systems of care, including schools and whatnot. Jackie, do you have anything to add to that?
Sure. And this is again when we were meeting in person. I'm not sure how that is taking place now, but we started off with making sure that we had a class on leadership development. We had, well, not class, but some training around leadership development. We had some training around policy and decision-making processes, and then also how to tell your story. It was, I think, one of the most rewarding experiences that I have had with the youth have been when we did the how to tell your story, and we interacted with each other. And so maybe this time you would be a legislator, or you might be the youth telling your story, and just sharing back and forth that way, and being able to, within that 3-second elevator speech, get your point across to a policymaker. And so that was some of the training, like I said, that we did initially prior to going into the virtual space. And so I'm sure that's something that, once things kind of open up, we'll pick that back up again, because that really helps them with being able to sit at the table and to share with policymakers and decision makers things that are important to them and help them to also participate comfortably in that conversation piece.
Yeah, and just piggybacking off of Jackie, one of the last in-person trainings that they had for before COVID hit, they were all struggling with IEPs. They didn't understand the meetings. They didn't understand what was going on around them. So they did come to us and they asked for training around that. And so we brought in a IEP specialist through the Department of Education, and she actually came to their session and she educated them. She asked questions to them. She allowed them to ask her questions, and it was amazing because even through that training, they still use it, even though they've done virtual classes and have done things virtually through COVID. It's amazing. Just to see, hey, this is what we want, and we do everything we can to give it to them.
Thank you. So back to thinking about the gift cards that you talked about, was it for a set amount of day or number of hours? Like what were the deliverables and how was it decided when youth would be compensated?
So normally we would do it in the past, and it may have been different prior to my role here, but we would give them a gift card for attending the full meeting or activity, whatever it was that we were doing that day. Most of the time it was for a meeting. So they would come in, and then once that they've attended and participated through the entire meeting, then we would give them their gift cards towards the end of the time. Most of the time the gift cards were about $20 to $25. And we tried to do it each time unless, they asked for something differently. They love food. So there was a time that they were just like, no, just use it towards our food. We don't want any gift cards this time. And so we gave them a huge Panda Express meal because that's what they wanted. And so, yeah, but generally we would use it each time.
Another excellent question that I know we've all sort of grappled with. How do you ensure within your youth advisory diversity and lived experience within your councils if the youth are just inviting their friends or folks from school?
Yeah. So here's something really cool that has happened over the last month or so. Our youth, when we think about diversity, right, we have to take into account them as individuals and their disabilities and the things that they like to see, right? And so one of our youth actually brought up, hey, we can actually think about diversity by the things that we post on social media and how we represent ourselves as the Youth Advisory Council, not just through pictures, but through quotes and sayings and different things like that. So we try our best to, one, of course, recruit as much as we can, look at applications, look at all the data from the applications on our end. But to them, they're just like, okay, diversity looks to us like somebody that has a different special healthcare need than me, or somebody that doesn't look like me, right? So we really try to include them when we think about diversity and how we can recruit and who we can bring to the table. So it's awesome to hear their aspect of what diversity is. But yeah, we definitely try to just recruit and promote through social media using a very various source of like pictures and quotes and sayings. And even one of our youth was like, Miss Kendra, don't use any pictures with puzzles. We may have special healthcare needs, but we're not a puzzle piece. We're not broken. And so she was like, maybe that may force people not to want to join YAC by seeing things like that. So, yep, Jackie, do you have anything?
Just give a reminder from our first summit, the one that we were able to do in person, how we had different groups and organizations there that actually, and the youth actually were part of the facilitation of that summit. But we had someone there who spoke about the, what it was like to be a part of the LGBTQ population and what that meant. And so there were several of you that then were able to join as members of the advisory committee, or they were already on as members of the advisory committee. And in speaking of lived experiences, if I think about the one that I think resonated with me most was with Monte, where he did the on the mental health piece. And so, and talking to the youth and making them feel comfortable sharing with us and with others, what their life story has been, and being able to then actually, they come on and they're able to recruit others to come on that may have lived or like experiences. And so while we don't have a set method of, we're going to go out and we're going to choose this population or this diversity, or looking at this, we try to include equity in everything we do, and looking at diversity and equity and inclusion. But it's sort of like, I don't want to say it just happens, because nothing just happens, but without putting like 1, 2, 3, 4, 5 and a plan in place, and this is how we're going to do it, we have been able to actually, I think, get better results for diversity and inclusion than we would have if we looked for specific individuals to try and recruit to join.
Great. Those are such great points. And you mentioned social media, and so that really cues up another question. What role do youth have in helping your Title V agency with social media and messaging?
Everything. Everything. So they have a voice in, for example, we have a youth a youth summit coming up. They were able to choose, okay, do we want to have this logo? They got to choose graphic, logos, messaging, anything before I submit it to Jackie to review. They have an opportunity to have a voice in whatever it may be. Even when we have a close relationship with our communications director. So if there's ever anything that we want to place, even on our state site or on our state social media, I kind of throw in the Discord, hey, what do you guys think about this? Does this need to change? And, they're very straightforward with what they like to see on social media, whether it's theirs, ours, or their council social media.
And then we have a shift to questions about, I'm just going to say this conversation is incredible. I can hardly keep up with all these amazing questions, but it's all right up my alley. So now we are going to jump into talking about healthcare transition, and how has the youth advisory worked on healthcare transition? Are they informed ahead of time about this aspect of transition? Is it a new concept? And then there was also, has any of your work or conversation on healthcare transition included both youth and young adults with and without special healthcare needs, or is it more of a focus on the CSHN population? And I'll just sort of let you take that topic and run with it.
Yeah, so we've actually had both. The first major activity we had around transitioning from a pediatric to an adult healthcare provider was actually back in 2019 when we had our first conference. We actually brought in a pediatrician, and the youth sat on a panel with her. We had some youth on there that had a special healthcare need, and then we had youth that may, recovering from cancer survivors, things like that. So all of them were in completely different stages in that process, but they were able to actually sit down with the doctor, ask questions, and she did the same to them. She would ask them questions. Hey, do you know what questions to ask? Hey, do you know how old you have to be in order to, make a decision, a medical decision? So that was our first big event, and it was a huge success. And they actually still use a lot of that information as they transition now into those providers. And then through the council, like through council meetings and things like that, they may ask questions. And luckily we have some amazing staff that works with us at TDH, where I could take the youth questions and then go and ask the actual doctor and vice versa. So they've had a lot of training and a lot of a safe place, I guess, to ask those questions and voice those concerns. Jackie, you've got your thinking face on. You got anything?
Thank you, Kendra. I just want to remind you, though, that the youth have been very much involved in building their own transition activities and transition planning and that kind of thing. Last year's conference was our first virtual conference, and they actually built a transition toolkit that where it included information on healthcare transition. We in Children, Youth, and Special Healthcare Needs, one of our programs, and one where we use the Title V dollars to pay for medical services, reimbursement for medical services and care coordination. We built a transition model several years ago that has what we call the 8 domains of transition. And so Kendra and the other advisors, the Family Voices Advisor, and then the others that work with them on putting together the conference last year, actually had the youth to build a transition toolkit where it covered many of those domains, and healthcare transition was one of them. And so we do make sure that we try to have that professional on board that we can ask those questions to, and that we can lead the families or the youth and their families if necessary to get those answers. Because while we always say we think we know, but we only know as that little bit that we think we know. And so trying to make sure we have someone there that can provide them with the other information that's necessary, but that is covered. And I think I saw a question earlier that asked if it was included in the IEP. Back when I worked with the individuals with the IEP, healthcare transition was not included. And I'll have to be honest and say I've not talked with anyone in Department of Education in a while about transition. However, I'm not sure, Kendra, if that's still the same, if it's not covered in the IEP, or if it is covered in the IEP at this point.
It's only covered, honestly, at this point with the IEP, if it's something that they want to see in there or the parents want to address in there, but it's not an automatic, hey, this is in here, this is a set in stone part of the IEP, unfortunately.
Another question that came up, how much has ableism come up as something that the Youth Advisory Committee members have brought up on their own to address, and how has that been a part of your work? And it sounds like the story about not using the image of a puzzle piece is a little bit getting at that, but can you expand on any conversations or how that's come up within your youth advisory?
Yeah, so when you think about ableism, yes, that puzzle piece is honestly a key factor that I always remember when speaking to them. Again, they have a strong voice, and they'll tell you, hey, this is what I like, this is what I don't like, this is what we would like to see, this is what we do not want to see. It's not a sensitive subject to them. They are very open, they're very honest. And it's never really been an issue or a concern on our end. Like I said, they've got those voices and they use them, and that's what we want. That's what we expect them to do.
Great.
And Kendra, just to follow up on that, and I think the example that you gave from one of the participants who talked about not wanting, I'm going to get it wrong, but she didn't want us to any longer like tell her how to fit in with us. She wanted us to learn how to fit in with them. So not being discriminated because of whether you're able-bodied or not. And so I think that they're the advisory committee, while they have not maybe called out the term ableism, I think some of the areas that they've worked on, some of the areas that they've expressed an interest in has led us to have those conversations indirectly. And so knowing that, in jobs and things like that, that they may be discriminated against because of someone else not having a special need or a special healthcare need. They've not necessarily called it out, but there's been some definite indirect conversations around the ableism aspects.
Mhm. And that's a good point too that Jackie brought up, was the fact, as we've mentioned before, we've had youth conferences since 2019. And this year they came to the table and they were like, every year you all bring someone in to talk to us and to train us and teach us how we need to adapt to the community. Well, this year we don't want that. We want the community to learn how to adapt to us with our needs. And so this year, the youth will actually be the presenters and the families will be the presenters. And they will be educating our community partners, our stakeholders, and other youth and families for the conference this year. So like I said before, they have their strong voices.
And I do just have to say, I'm going to be a little bit biased for a second because I had the honor of attending one of these youth advisory conferences in Tennessee with Kendra, and it was one of the most incredible youth-led, youth-driven endeavors I've ever seen. So when I saw her name on the agenda, I was so excited to have this conversation. So it's something to see for sure. They are definitely blazing the trail. So one other question, going back to thinking about technology and social media, Emily asked, how do you comply with FOIA requirements when using Discord? Sorry. And Emily, if there's anything you want to elaborate on to clarify your question, feel free to put that in the chat or unmute yourself. But Kendra, do you want to speak to that?
Yes, Freedom of Information Act. I know it well. We actually, before we were able to do anything regarding Discord, we had to get consent forms, not just from the youth, but from their guardian as well. So I actually had to connect with our legal department at TDH to create a online form, a virtual form to send out for the youth and the families for them to understand what that was, what Discord would display, not display, and X, Y, and Z. So that itself was a completely different process before we were allowed to use GroupMe or Discord.
And now I got
sorry,
everyone all excited about your conference, Kendra. What were you saying?
I was just asking, did she need to elaborate any more on the Freedom of Information Act? Or
Emily, did that answer your question? She said yeah in the chat, so I just want to make sure.
Perfect. Yes, I know it very well. It was
perfect.
Scary at first, Emily, to hear all of the legal aspects behind Discord and GroupMe, which is why we don't do any other platform outside of those two platforms, just because that act was brought up a lot and we got our legal department on it. So
that's really helpful information. I think, we always sort of jump to social media and, how these platforms that pop up so fast, and making sure that we, are doing what we need to do to keep everybody safe is so important.
Of course. Yep.
So Nina asked, is the conference open to all youth, and do youth and families have to pay to attend the conference?
No, it is completely free. And yes, it is open to everyone. I will somehow try to get the flyer link out. Mallory, I don't know how that would work, but yes, it is definitely open to everyone.
Kendra, could you make the toolkit available? So Jerry has put in a link to a toolkit that's on TNAP's website, but that's not the toolkit that the youth created. So if you could make that available also. I mean, you don't have to do it right now. We can try to get it to AMCHP and they can maybe make it available.
Sure,
Mallory, since she's
yeah, absolutely.
Okay.
But yes, the toolkit, as Jackie mentioned, because it was our first virtual conference, we didn't necessarily know what they wanted the transition conference to be about. And so they were just like, okay, well, we're going to create our own toolkit since, we don't want to follow anybody else's. So they literally covered every single domain, from legal to social, recreation, post-secondary education, medical. They covered everything. And then once they created their toolkits, I went and found presenters to present on each section of their guide. So it's definitely amazing, and I would love to make that available for you all.
And they were provided an opportunity, or had opportunity during the conference, to actually complete those sections of the toolkit that were relevant to where they were in their transition planning. So it was not only they created the toolkit itself, but they actually could create a transition plan based on those domains and the things that they wanted to see during the time of the conference.
Yep. So by the end of the conference, all of them had their own individualized transition guide.
All right, so we have about 4 minutes left. There's another question about the conference. Lots of questions about the conference. Is the conference covered by Title V? And what stakeholders do you engage to put the conference together? And then what were the dates for your next upcoming conference?
Okay, I don't know if I caught all that, but I will try my best. So the dates for the upcoming conference is June 23rd through the 24th. And it's a virtual conference. So yes, as mentioned, anyone is able to attend. And right now, our planning committee, we're working with Family Voices of Tennessee, a couple of their staff, and then we've had input from our youth engagement work group, which it's composed of like Department of Workforce and Labor. We've got DIDD on there. We've got Department of Education. We've got Department of Children's Services. So we've been able to get multiple input throughout the planning process. And of course, the youth who started all of this, they get all the input in the world. And then, but our planning committee is us, and then Family Voices of Tennessee, which is the contract that we oversee.
And Kendra, we do have, or we have had in the past, I know, Medicaid as one of our participants or collaborators with the conference. And so they always want to be around where the youth are to try to push their agenda as well. And we're glad to have them to participate with us. As far as whether Title V covers the conference or not, if there are costs associated, like I said, we have a contract with Family Voices, and funds are put in that contract to be able to cover any costs that are associated. And that's part of the contract, that we have an annual conference. And so, yes, indirectly or, well, directly, the Title V funds do cover the conference for any costs that we may have.
Mm-hmm. I know I missed one. Thank you, Jackie.
Excellent. And if you want to follow up with me and send any of those materials, we will make sure that folks get the information. And also, all of this is being recorded and will be available after the conference. So feel free to come back if you joined a little bit late and listen to the whole presentation and all of the amazing questions and answers. Thank you, everybody, for being so engaged. This has been so informative. So in our last 2 minutes, does anybody have any final thoughts, any closing thoughts, Kendra or Jackie?
No, Mallory, just good to see you again. And like Mallory said, she was our first keynote speaker for our first conference, and we were so excited to have her there for that. And just, it has been a real pleasure to work with Kendra to pull together our youth advisory. I mean, we started before she came on staff, but Kendra, as you can tell, has that energy, and she is very youthful. And so it makes for a win-win situation. The youth really enjoy having the opportunity to interact with her. And I think that helps us to be able to get them more involved, seeing that she's involved, she's a youth. And so they're like, well, if Kendra can do it, then I can do it. And so it's been a really, really good opportunity for us all the way around to have the youth and have them as a part of what we do in Title V.
Absolutely. Thank you, guys. Yeah, this was, you guys had such amazing questions, and I hope that you can take some of these ideas back to your own states, as you saw in the presentation that you just watched. Just building your own blueprint and being able to implement these strategies in your own state is so important. So I hope that this was a great informative session for you.
Thank you, everybody, and we hope you enjoy the rest of the conference. We'll see you later.
Thank you.
Thank you.